Hospital has shut down its entire kitchen as well as 3 other areas. Concerns were raised about health measures not being followed. Tygerberg is one of the facilities dedicated to COVID-19 patients. In conversation now with David Esau, the Provincial Chief Inspector at the Western Cape Department of Labour. Mr. Esau, good afternoon to you. What did you find at Tygerberg?
Well, it wasn't a good sight, to put it mildly. Clearly, the employer would not understand the whole issue of having a risk assessment in place and putting control measures in place. And to me, that was the biggest disappointment. And from there, it all just spiraled downwards.
What specifically was concerning you?
Well, the 3 areas to me that was very worrying was, number one, the lack of proper screening for any people that entered the facility. And number 2, the isolation of those who have been in contact with COVID-19 patients. And thirdly, your process of tracing and placing people that have been contaminated into isolation. And to me, those were the 3 areas why we had to shut down those areas, because you can't continue operations as if it's normal. And that's why they had such a high increase in infections. They had no program in place to deal with how to isolate those who've been affected by some of their colleagues that tested positive.
Those are 3 very big issues. When you raised them then with the hospital authorities, what did they tell you?
Well, to be honest, I was quite surprised, because they seem to have all the knowledge of all the medical doctors they have there, and I think there's a mismanagement, or they're just so overworked that they cannot tap into the knowledge of the medical staff they have there. So there's this juncture between the administration and the medical facility that you have available there. So the way that patients are treated are fine, but the way that workers are treated in relation to patients is a huge problem in that hospital. And that's one of the reasons why I felt it was important that we make this example. But secondly, we also have sympathy with the fact that this is most probably the biggest institution in the Western Cape that deal with COVID-19 patients. And if it wasn't for that, I'll be honestly closing the whole hospital.
Let me ask you this question, because you raise a very important point. Is it your belief that this was negligence, in other words, people not doing their jobs properly, or, as you've suggested, this is an institution that in many respects is overwhelmed because of the COVID crisis?
To me, it's both. I do think that they have the necessary personnel to deal with this thing from an administrative point of view. They didn't do that. You cannot tell me in this modern age that you still don't have a risk assessment. And there are so many regulations that tells you need to have a risk assessment. They had nothing. And all 3 federations that were present during the meeting yesterday has raised this matter with them for the last 3 weeks to make the risk assessment available. And they did not have one available. So that's an administrative point. And then secondly, the lack of number of personnel to deal with the influx of patients has led to overcrowding, and overcrowding is dangerous when you are dealing with social distancing. And therefore, I felt it was so critical for me to pinpoint this out to the hospital, that some of the areas they are working in with do not have enough personnel to deal with the number of patients they are dealing with.
Thank you very much. David Esau, Provincial Chief Inspector at the Western Cape Department of Labour.